Oh, hi, Kindertopreneur. So this episode, it's episode 10. I have something really special. I have a Dr. Vania Martin. She is a gynecologist graduating in the medicine in Brazil in 1993. She has got her clinic in London. She opened her clinic was in 2009, Dr. Vania?
2013.
2013, you opened your clinic, and then she's concentrate in women health care and IVF and the men's as well. And then she also does transmitted disease, sexual transmitted disease. She's also does a lot of things with young generation as well about what the vaccination they have, the
HPV virus.
HPV virus.
Yeah.
And then, so it's an honor to have you with me, Dr. Vania. And then I'm just going to let you also to continue to introduce yourself, just say hello to the girls, and then we starting our conversation today.
So, hi, Marta, Super Marta Samson, great coach.
Thank you.
Brazilian lady speaking very good English. I'm so proud of her. Really hardworking lady. You have done some job together. She's very good and a strong lady. So my name is Dr. Vania Martins. My background is obstetrics and gynecology in Brazil, Rio de Janeiro. I did a Master of Science here in London at UCL University in reproductive medicine. So I also work with IVF, fertility issues, egg donation, all those things. I love working with hormonal imbalance, polycystic ovaries, thyroid issues, STI, HPV, cervical cancer, breast cancer, endometrial cancer. I love. So why I decided to do medicine? Marta asked me, why did you decide to be a doctor, Josevania? Yeah. Well, since I was a child, I always like helping people. So I think all doctors says the same. Another point is to treat myself. Because in Brazil, when I was born, I'm not going to say when, I used to think the doctor was too cold and so objective. And then, so I decided I want to be a doctor because I can study my own body, I can help other people, and I can treat myself. It is the main issue. And I'm like a detective. I like investigating things. When I did my studies here in London, I became very skilled in ultrasound, 3D ultrasound. That's something very new. And I have had loads of cases of endometriosis, adenomyosis, ovarian cysts, polyps, fibroids that go under diagnosis in some cases. And I'm very happy when I can see these and tell the patient I have a disease and let's treat. That's it. Not that I'm happy that the patient is sick. Is that I'm happy that I'm discovered and I'm able to guide. This is the main point of being a doctor. The advantage of working for myself in my space is that I give the patient 1 hour consultation, 45 for an hour. So usually go to the conversation and then we go for the ultrasound and I discuss the results. So less than 45 minutes, 1 hour. It's difficult to do all this. So this is the reason I became a doctor.
Oh, that's really caring. Thank you. That's really caring. So, the topic, what topic are you going to discuss with us today, Doctor?
Well, Marta sent me some questions. Vania, could you speak about hormonal issues after age of 40? Well, it's a great topic because, as you know, we are living more than men, okay? It means that we are going to spend 50% of our life in perimenopause and in menopause. What is the difference? Perimenopause is the transition. That I'm going to speak more about this. Menopause is when there is at least 12 months or 1 year that you don't have periods at all. But this transition, when the hormones start to go down or fluctuate, that is it's difficult for us because most of the time we don't know. Some of us had one thing called premature ovarian failure. It means that ovary failed in a very early age, 40 or less. I have to say is a very bad thing because You can have loads of issues. I'm going to speak soon to you. So hormonal imbalance can give loads of things: lack of energy, depression, lack of initiative to go to work, to invest. You become insecure, low sex drive. Why? Usually because your estrogen, that's called female hormone, start to go down, 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 down. Your progesterone, that's the hormone produced in the second phase of the cycle from day 14 until day 22, goes down as well. So, and then become very moody, with headaches, intolerant. So if you are a businesswoman and you want to do a good job, it does not matter what it is, if you are a cook, or if you are a nurse, or if you are a coach or psychologist, you need to be ready, because most of the time we deal with patients who have already a problem. But if you is not fit enough, you cannot help the patient, because the patient looks at you and they know, she's impatient today, or she's not well. And then first of all, you're going to lose the client, or you're going to give up. So, and then you're going to say, well, I cannot do anything, or I cannot go ahead. Nothing goes right to me. Everything goes wrong. But it's yourself. It's inside of you. But you cannot see, because sometimes you need some advice. You need to look for help. So the topic of today is about hormones.
Okay. So I get a lot of clients who are coming from coach, like women who are going through career transition. They are no longer enjoy their job anymore. And then I start to notice that during the coaching program, some women, they can get very motivated, but some of the women, it's kind of very hard, even for me as a coach, how to elevate that motivation, because she's feeling that she's no longer, she doesn't want to, it's almost she wants to do something, but the next day it's like she hasn't done anything. And I noticed during my KPI that I collect the data from people. I'm not going to share names because of confidentiality, but I noticed that the majority are over 40s. That's why I brought you, because I thought that you can bring something that the women entrepreneur can starting to look better for this low energy, lack of energy.
Lack of energy. Yeah, because the thing usually is good as a coach or psychotherapist or psychologist, always to work linked with might be a doctor or dietitian or someone, or psychologist, to help you. Why? Sometimes it's not about just the coach. It's about change style of life. Okay, so diet. Looks like I'm not here to tell about diet. I like to speak about change your lifestyle.
Okay.
It's about this. Okay. Sometimes we eat too much rubbish. What, Vania? Too much sugar, processed food, too much coffee. Of course, coffee is necessary for some women, but not too much. So maybe you are allergic to casein, allergic to lactose, gluten. So first thing, look at your diet. Or if you cannot change your diet because of a job, look for help. There are coaches for diet, there are dietitians, or you can go on the internet. I don't have the resources, it's too expensive. So look on the internet. What kind of, there are billions of diets. You can use antioxidant diet, anti-stress diet, diet for thyroid, diet for polycystic ovary, diet for menopause. Of course, there are loads of crazy stuff, but at least can give you an overview of some things. The first thing is look at what are eating, because the issue is you are what you digest, not what you eat. So if you eat plastic, you're going to have an indigestion, because you make the gut, okay, it's called small intestine, upset. If the gut is upset, your brain is upset. Why? Because in the embryology, okay, they come from the same area. The only difference is that the brain stays here and the intestine goes down. Okay, so if you eat something that intoxicates you, you're going to change your whole hormones. usually in that age, the first one usually is thyroid, suprarenal. Now, thyroid is here. Suprarenal is at the top of the kidney. Hypophysis is here. The ovaries are down below. And there is another new study speak about pancreas because of the insulin. Okay, so if you have insulin resistance, okay, what happens to you? You're going to start to produce more male hormone. So it can give acne, alopecia, depression to begin with. If you produce too much cortisol, cortisol is a double-edged sword, because if it's too low, you can have a problem. If it's too high, you can have a problem as well, because you need some level of cortisol to keep the suprarenal running. Okay, if it's too low, it's called Addison disease. So you need to take some corticosteroid. If it's too high, you need to decrease. Most of the time, it's very high because of continuous stress. What is stress? Stress is like Marta said, they're not happy with the job. It's a cause of internal stress. Say, I'm not happy with the job. Why? Is the wage, is the environment, are the people. But first you need to look inside of you. If you are not happy, okay, so the only way you need to study and do something and leave the job. But most of the time we work because we need the money.
True.
So yeah, and then every time you wake up, when you open the eyes and you think that you have to go to that office, you are already stressed. You start to produce cortisol, and then your insulin does not work. And then you go for your breakfast, you do not digest your breakfast properly because your insulin is not working properly. It's called insulin resistance. Okay? So, and then all this insulin goes to your thyroid, go to your ovary, and cause called metabolic imbalance. And then you cannot function well. Well, but what helps? Exercise. It's very good. Vania, it's too cold, it's snowing. Come on, guys. There is always a way to do exercise inside the home. You are in Europe, it's not easy. But you need to do some, how can I say, aerobic exercise. It's very important because when you do the aerobic, the insulin starts to work. And then you put all the breakfast inside the cells. It leaves the bloodstream, it goes to the cells, where it should be. Otherwise, what's going to happen is going to have your breakfast, all the sugar is going to be in the blood and the brain starving. Because, there is no sugar inside the brain. It's all in your blood. You know what I mean? And you had a very good breakfast, but your brain is starving. How can you function with your brain starving? Can you tell me? It's not possible. Your brain is suffering. So you cannot function properly. So you cannot think properly. You cannot sleep properly. You become upset because you are running in low level of sugar, good quality sugar inside your brain, even though you had a good meal. So this is very important. Insulin resistance, thyroid. About perimenopause is another thing that's very difficult because if you have a low level of estrogen, okay, or sometimes to go up and down because this is the transition is difficult because one day the estrogen is okay, another day it's low, and then you start to have hot flushes. It's like, oh my gosh, too hot here. Don't you feel it's too hot? Oh, I'm not feeling it's not hot here, but you are feeling hot because the hypothalamus is completely mad because the ovaries send the message and tomorrow don't send the message, and then you have these fluctuations, and then when you have a crisis of hot flushes, you become very impatient. You become completely wet. If you had a blow dry, your blow dry is going to be destroyed. If you have makeup, it's going to be awful. So, and you are seeing a patient or seeing a client, it happens to you. The client's going to look at you. The client is going to see that, well, something's not right with my coach. So the client's going to say, she needs help. How he can help me if she needs help? So you need to help yourself first. See, where is the root? Because most of patients, they treat not the root. It's like a tree. You cut the leaves and the leaves goes again. You need to cut the root of the problem. But how? You need to investigate. Where is my husband? Is my house? It's myself? Where is the issue? Most of the time, the problem is ourselves. Most of the time, it's ourselves. And then there are many ways of, I told you, of the ways of you can help yourself.
Okay. So how about also, I was thinking, some of the women entrepreneurs who are not feeling all these, they are not feeling the symptoms, they're feeling happy, they're just like very busy with their business, they're thriving, they're making money, but they're feeling this hot flash thing, and then they are not looking for see what is this sign. Is it okay for them to feel, oh, this is just like I'm over 40, this is normal? Is it normal?
Okay, hot flushes, it's not normal. Okay, what is hot flushes? Usually when you have, it's like in the head, looks like your head is boiling over. It starts in the head because the problem is here in the called hypothalamus. Okay, and suddenly you feel cold. It's not normal. Okay, so you cannot think properly, you cannot function properly, you cannot have a proper sexual life, and sometimes you have mood, low mood, you become depressed, like you could bipolar, but you become bipolar because you have a root, you are in perimenopause. What you should do, you need to have a blood test during your period, must be during your period. Doesn't make sense to go to a GP or come to see me. You should come during your period, go and collect the blood to check some hormones linked to perimenopause or menopause. Okay, depend on the results, we can start the treatment immediately. But the protocol is you need to repeat the blood test again in 3 months. Okay, if the patient is in acute crisis, of course, I'm going to treat them, but I tell them, stop at some extent, let's have another blood test to put in the notes, okay, to be the right thing. Because there is a hormone called FSH that when you are going to menopause, it goes high, and estrogen, that the female hormone, goes low. Okay, we need to check at least those two, just to give you a brief overview, because too many names. But there are, here we do the whole bunch of hormones. We check hypophyse, thyroid, suprarenal, ovaries, check everything. Pancreas, liver, kidney, blood, vitamin D, you check everything, because there is one thing called, I call it HRT, but there is a new name they're using for modulation, hormonal modulation. They say the hormone is natural, blah, blah, blah. It's the same thing at HRT, because before you used to give just hormone from menopause. Today you use many more things. Sometimes most of us going to have hypothyroidism during this period. I have had loads of cases here, loads of cases. I don't know if I'm giving more diagnosis. I believe I'm giving more diagnosis. Oh, it is increased. So, then you always check your thyroid, your suprarenal, because sometimes if you give some male hormone, it's not licensed in UK, give testosterone, but sometimes you need to give. And sometimes you give hormones from the suprarenal because they produce male hormone. But in order to do that, we need to check the hormones, because if you have insulin resistance, your testosterone is already very high. If I give you more, you're going to have, beard and blah, 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 all those things. So because you need to check the hormones. But if she has hot flushes, first thing to do is check the hormones for perimenopause or premature ovarian failure if she's 40 or less.
Okay. I think with a lot of women, there is so much details. I can go on and keep it talking. I don't want to go so into many details, because I know you are my doctor. No, you treated me. That's why I trust what are you sharing. So what do you want to add? Any more tips? How often these women should be going to a clinic to see a gynecologist like yourself to check?
Well, you need to be very clear, because you have a public system, you are in the United Kingdom, and you have a private system, okay? In the private system, there is no time frame. If you go to a GP with hot flushes, you're going to say it's normal, okay? You can put a fan and that's it. It's a fun.
Really?
That hormones give cancer, you should not take. It's not real, okay? As I told, we are going to spend 50% of our lives on menopause. Most of us in Europe are going to die at the age of 90. If you go menopause of 45, it's going to be exactly 50%. Okay? So, because what is the problem of not taking the proper hormones that you need? Osteoporosis, dementia, cardiovascular disease, stroke, you cannot think, a lack of cognition, you cannot remember things. You become very forgetful, okay? Depression, dry vagina, you have sex, it's like a hell. You try to avoid your partner because the vagina closes. When the movement starts, it's like burn. And you finish having sex, you go to the toilet, you pee, it burns like hell. So your body always gives you, if you are having hot flushes, probably the lubrication of the vagina is already low. So because this you need to check, because if you are going on menopause or perimenopause, you need to have vitamin D because of the bones. You need to have all the vitamins necessary for you. So what I say, you should go every year to check transvaginal, ultrasound, blood test. I know that costs money, but it's necessary. Mammogram is very controversial because it's radiation. But if you have breast implants, okay, you can have MRI. It's more expensive. Ultrasound we do at the clinic, but it is not for screening. Just very clear. It can check the processes. It can check if you have cysts, if you have lumps. It's very good. It's the best approach, but it's not for screening of breast cancer. Okay. If you have a virgin breast and you are 35 or more, you can try a mammogram. If it's too dense, if nobody can see anything, everything is white, and they're going to tell you to have an ultrasound. But I always recommend, if you can pay, because it's outside of the screening, sure, it's a private, okay, it's not NHS, have an MRI. It's good because they put a fluid on your vein and like a milk. And then if you have calcifications, because some cancers, breast cancers, they start with calcifications, no lumps. Ultrasound cannot see. If you had a plastic plus processes, your breast is a mess. Definitely mammogram is going to lose. MRI, when it makes a mistake, it makes a mistake for more. You know what I mean? It's better to discover more things than less. Don't miss anything. Because we don't do any hormones without checking uterus, ovaries, breasts, and hormones. We never do this. And then because of this, some people, hi, doctor, it's too many things to do. Well, I'm not going to prescribe anything. I don't prescribe. Because I don't want to give you a problem in 5 years, 10 years. Because if you have any issues, it's going to take some time to show up. Or maybe you already have something. I'm going to make your life worse. I have some patients, they have cysts. I say, okay, we need to treat the cysts first, and then you go for treatment. But they are in very difficult, they're hot flushes, they are depressed, they are anxious. So it's difficult. And I have to prescribe alternative medicine that does not help with the cognition, cardiovascular disease, but at least helps them to decrease the anxiety until they sort out these issues about the cyst or fibroids or whatever, and then you go for hormones.
Okay. Just one final thing, because this subject can bring so much. Another thing is, I just remember, I on my notes here, I didn't ask. A lot of the women tend to say, like, I feel anxiety, I feel panic attack. This is symptoms for the perimenopause.
Well, it depends of the age. Look at the diet first, okay? Many people are eating loads of things they should not do because they don't know. If you want to eat health, costs loads of money. If you spend some amount, if you're going to eat healthy, you're going to spend the double, okay? But it's worth to invest on you. Because if you invest on you, you can invest in others, okay? So look at age, look at the diet, if she does exercise, relationship with the family, relationship where she works, relationship with the community. Because if she's not happy in the job, at the home, in the community, she needs help. Of course, maybe she has true depression, but usually anxiety brings depression because you decrease the level of serotonin. When you have not enough serotonin, you become very low mood. I don't want to do anything. I don't have a shower. I don't want to to go to hairdresser, I don't want to do anything. And then, of course, you can give some hormones to increase serotonin, but you can increase it naturally, exercise and good diet. But the main point now, what is new? Small intestine. Because if your intestine is sad, your brain said, you should, and then you can have depression because of this. But if you eat very healthy, you're not overweight, and everything is relatively good, you go for hormones. You need to check how your hormones are, because hypothyroidism can give depression. Low level of estrogen can give depression. Low level of hormones of suprarenal can give depression. So it's multifactorial, but usually the cheapest way and easy way, because sometimes some patients can treat themselves without going to doctors. But of course, if you have no periods for 3-6 months, something's wrong. Maybe we are going on menopause, who knows? Maybe you have polycystic ovaries. That's another problem. You become very obese, gives depression as well, for all of kinds of reasons, because your skin becomes very oily, have loads of acne, your hair starts to fall. So I don't think you're going to be happy like this. So your self-esteem goes very low. So, and maybe you work with women. You know, women, they don't dress for men, they dress for another woman. So, and then, so you know when you are not, how can I say, you know when you're not secure and you're going to a party and you see someone else, wow, oh my gosh, I'm so ugly. So, and then the problem already started, because you go, ooh, you think that nobody knows, but everybody knows. If they look at you and they know this woman is completely insecure and this and that, blah, 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 don't want to speak, don't want to show up, because they say, Dr. Vania likes to show up because I'm secure, I don't care. I don't care. I just do things that I think that are right, should be done. That's it. And you have to learn how to say no. That's it. So there are lots of things the coach can do to help, to empower. But sometimes are hormonal issues, diet issues, relationship issues. So as a coach, you can maybe identify and just guide the patient. Yeah. Have a blood test, have an ultrasound, or I think you need psychotherapy together with the coach, or you need a dietitian, or you can investigate a bit. What do we eat? What are we eating? Oh, I have dinner midnight and go to bed. Oh, really? Oh, yes. So what do we eat? Oh, I eat loads of carbohydrate and red meat and beans and blah, blah, blah. Those things about diet, it's not important.
It is important.
It's very, very important, yeah. Because you can become very energetic if you eat if you give your body the right nutrients that it needs. But if you give wrong things, your gut, never forget, if your small intestine is sad, your brain sad, because they come from the same area. Okay, yeah. This is very important, because if you eat something that's not good, you do not digest. This is the problem. You do not digest. You have inflammation in the gut, in the small intestine. So, and then it's going to disrupt the whole system. They give you called metabolic syndrome. Okay, it's very difficult. If you are intoxicated, you can have headache for 3 days. You don't know why. Oh, I can't put a headache. The rubbish that you had 3 or 4 days ago in a party or something. So, but maybe you don't know. So with if your gut inflames, what's going to start to happen? You're going to become allergic for normal food, because it loses the capacity of recognize what is toxic, what's not, become crazy. And then you have a problem, because become very sensitive, and then you develop food allergy. That's happening a lot in the UK. People are coming to UK. I didn't have this allergy, but now I have. Why? Because you had so much rubbish that your gut's completely mad. It takes years for you to rebuild the whole bacteria, make it work fine. Okay, so sorry, I speak too much.
No. This is really good. This is exactly why I brought you to just introduce yourself, just tell what you do in London, because when I talk to my clients, I do talk about my experience when I went to your clinic. I use my story to be in in that footstep that you feel the symptoms, you have just to go. I went to my GP, it wasn't that well. No, I had to pay the money. So thank God.
What did you say to them? Because I cannot, what did you say? And then I can take from them, because I cannot say for.
Yeah, I know.
Yeah, you can say. What do you usually say to your clients about your history?
No, I only share that it's important to go to a private doctor as well, because from my experience, went to the GP wasn't necessary, didn't solve my problem. So I had it.
How long did you take how can I say, for the penny to drop? How they say in English? How long did it take for you to recognize and decide to spend the money?
Oh, for me was quite straight away, because I am very self-aware when things are going wrong in my body, and then I tend not to trust a lot of the GP doctor. I'm terrible. And then my GP doctor know when I go there, and then he said, like, what are you going to tell me now, dear? So,
you challenge them.
Yeah, I challenge them. He's hating me for that anyway. Probably. I don't know. That's what I think. But anyway, so my experience was very like it, I just have to go and then to see. And then was through an event that I met you through an event, because I did.
Yes.
And then I straight away, I met you in the same month I went to your clinic. Because I was searching, that time I was searching for a gynecologist, and then I said, like, oh my goodness, okay, so here is she, and then I booked. So it was just like it was the result. I tell people, and then I do have other people who are therapists and counseling. I'm no counselor. I said, look, I am a life coach and I'm a business coach. This is people I trust. These are people I partner with. You just go there and then say, that's Marta recommended me to you, because I know they're going to treat you well. And then brought to you here today because I think the subject of in women entrepreneur, it's a lot of up and down, and sometimes people are not pushing hard even to achieve their goals because of this imbalance in their life, diet, and then premenopause, menopause, so
thyroid, suprarenal, lack of exercise,
exactly,
bad relationship in the marriage or with the friends or in the job. It's a pack.
Yeah,
a pack of things. But if you are energetic inside, you can fight.
Yes.
But if you have no energy, they're gonna kick you out like a ball. It's not the way. But if you are strong, they cannot take you out, because you are going to fight, and are going to stay. There's no way to take you out, because you have the balls, how they say in English. You have the energy. They hit you, you stand and go until they, okay, I give up. With that one, I can. So they give up of you, and then you go away. But you need energy. You need motivation.
Exactly.
So what I'm trying to give you is some reason for you to have more motivation. Because life is, you sorted out a problem today, tomorrow you have three. You're never going to finish. Yeah, it's not about this. You're going to have another problem to sort it out. So you just need to have the energy and the brain working properly. So to have the ideas. Because maybe you had the idea, it didn't work, you just give up. Okay. No, it didn't work. Okay, made a mistake. Okay, let me do another strategy. Maybe it's going to work.
Yes.
Let me connect with other people. Maybe it's going to work with that people. Just because it didn't work with someone does not mean it's going to work with someone else. So it's like trying. If you are into partner or someone starting a business, you are going to commit many mistakes. It's normal. It's normal, because you need to learn with the mistakes. Because when you learn with the mistakes, you never do it again. I'm telling about myself. When you learn with the mistake, when someone punches you, you say, okay, thank you very much. I never do it again. You learn with the mistakes. It's very good. Of course, you have the feeling sad and this. Okay, do some exercise, read a book, listen to music, change your diet, go for a trip, meditate. Do what is good for you, because there is a healing. Every time someone punches you, there is a process of healing. It's like when you have a surgery, you don't have a surgery today, you run tomorrow. No, there is a healing process until, okay, you overcome, and it's okay, now I'm ready to fight again. You cannot give up. But if your hormones are very low, if you have lots of menopause, perimenopause, hypothyroidism, obesity, polycystic ovaries, and then it's more difficult. What we're trying to do is like working partnership, because Marta may identify something and she tells you, maybe you don't listen to, and then her job has no result. You're going to say, wow, I guess this coach. It's not the coach, it's you. The problem is you. It's like a patient who has high level of male hormone, testosterone, he have a laser hair removal, for example. You know, testosterone gives hair. You can have 10 sessions of laser hair removal with the best machine that burn everything, the hair is going to still there. It's from inside. It's not because the beautician is not good. It's you. The problem is inside of you, but you don't see it. You like blaming others. This is not good. Look at yourself first before you blame others. Most of the time, I know because I'm a difficult lady, the problem is with us. Most of the time. Most of the time.
It's true, Dr. Vania. Thank you so much.
No
so
problem.
if people want to get in touch with you, book an appointment to go to your clinic, where they can find you, and also if you can share, I will share all your social media platform, your website on where the podcast is live. I'm going to share all your links, but I think it will be good if you can tell them where they can find you.
We are located in Hampstead, in a very good area. I really like Hampstead. It's a very nice area.
Very posh.
No, not posh. It's a good area to work. It's quiet. People feel happy when they come because it gives peace. Because most of the patients, they come or stressed or with anxiety or with panic attack. So, and then they need a place that can calm down. Usually the consultation takes 1 hour. So you need to be ready to stay with me at 1 hour at least, okay? So the address is 49 Netherhall Gardens. The postcode is NW355RJ. The telephone, I'm gonna see 0330113842. You have a WhatsApp number, cell phone 0759 746-2121. And you have Facebook page called DR Vania Healthcare. There is our Instagram at Vania Healthcare. We have LinkedIn as well, Dr. Josevania Martins. So you can just Google me, called Dr. Vania Martins, Brazilian gynecologist on Google. You're gonna find me immediately. There is no way to go wrong.
That's it. I know people will find you. Thank you so much for your time. I know you had your busy day today, and then it's quite late, and then we do this podcast interview. And then thank you so much. And then,
So I say thank you, Marta, to invited me for your postcard. I wish you all success. You are a very great lady. You are very hardworking.
Thank you.
We have all disagreements as normal, but you are professional. For me, this is important. Okay? I think I'm more focused now. And then you are growing. I'm very happy to see you with new ideas. She came to me about Zoom. I said, how is the Zoom? And now I have a platform with Zoom as well. So I'm very happy. I'm very happy for you. You are very competent. You have a bright future. But life is not easy. No. I don't think people are going to make your life easy. You have to fight for your space. Okay? Maybe because I still have this stigma about color of skin and things like that. But the most important thing, if you are competent, nobody can stop you, and nobody going to stop you because you are. Okay? Thank you very much for inviting me.
Thank you so much.
Yeah.
Lord.
Pleasure.
See you.
Bye.
Bye.